Now, I want to look at another type of drugs. That's in pharmacology. Another types of it's a group of drugs. It's not one drug. It's a group of drugs. So they call these types of drugs immunostimulants. Okay, immunostimulants. So if they give you something like this, just try to define terminologies. It goes a long way in helping you. Anything immuno, you are dealing with the immune system. Stimulant is anything that will kick something into action. You understand? So immunostimulant is this. Of course, this is your immune system. So if you say immunostimulant, you are giving a drug that will assist your immune system function better. So just so you know, there are agents that enhance the body's immune system. Now they act by stimulating innate immunity and also the adaptive immunity. Everything you see here. You understand? So they do this through different mechanisms like cytokine release, activation of pattern, recognition receptors, boosting antigen presentation. So clinically, you use them in infections where the body's immune system is weak, so you want to, step it up. Cancer immunotherapy where you want the body's immune system to fight the cancer cells more, and also they can be used alongside vaccines. Definition and general rule is immunostimulants, also known as what? Immunopotentiators. They are drugs or biological agents that increase the immune responsiveness. So they can act non-specifically, where they activate your immune system in general, or they could be specific, where they activate a particular immune pathway. Pharmacologically, they are crucial in vaccination, cancer therapies, and also treatment of chronic infections. Okay, so let's quickly look at their classification now. So mechanism of action in general, you have cytokine induction. So agents like interferons and interleukins, they stimulate your immune cells to proliferate, that's make more copies of their self. They could also have activation of pattern recognition receptors. These ones are bacteria-derived products. They activate the innate immunity via the toll-like receptors. Then we have enhancement of antigen presentation, where some immunostimulants, they increase dendritic cell activity, they improve T cell priming, then also bone marrow stimulation. Okay, depends on where you want these drugs to act at. Now, example, we have interleukins like the aldesleukin. Okay, see, you can pause to observe it. So aldesleukin and also the recombinant interleukin 2. They promote the T cell to make more copies of itself. We have interferons like the alpha, the beta, the gamma. Okay, glycoproteins with antiviral, anti-proliferative, and immunomodulatory effects. Then we have the BCG, which is a vaccine. Okay, which is also known as a Bacille Calmette Guerin vaccine. Life attenuated vaccine, and it stimulates the immune system to basically protect you against tuberculosis. Then colony stimulating factors, this ones they stimulate granulocyte and platelets production, because these granulocyte and platelets, they form the key core of your immune system. Then we have other drugs like the thalidomide, we have the lenalidomide, we have the levamisole, we have natural products like plant-derived immunostimulants, So pharmacokinetics is the protein-based ones, they are administered parenterally. Okay, I think this is just by the way. Okay, so clinical application, which is the most important part of the lecture, used in treating cancer, used in treating chronic viral diseases, different types, right? Used in treating all those blood-related cancers. Also used in vaccination, where it basically protects your body against future disease conditions. This is Oprelvecin. Okay, so that's it. So adverse effects is it could be toxic, causing you fever, malaria, hypotension, capillary leak syndrome. Interferons, they cause flu-like symptoms. Then BCG, just local irritation there, and sometimes might cause you a tuberculosis if your immune system is not strong. So your immune system must be competent. So general risks is sometimes it could overstimulate your immune system, which will not be nice.